So, how are specific stages diagnosed, and how are they do they differ from each other?
Yeah, so as I mentioned, if you're part of a screening protocol, so patients with cirrhosis or viral hepatitis, I'm sorry, specifically hepatitis B, you should be undergoing surveillance or screening for liver cancer. So right now, guideline recommendations are imaging of your liver with a good ultrasound of your liver and a biomarker called AFP or alpha fetoprotein. So studies have shown combining the two actually increases the detection of liver cancer. And again, as I mentioned, you're trying to do it early. Now, these are for people with known risk factors. So, and again, we're focusing on HCC. In patients that have risk for bile duct cancer, there's different types of bile duct cancer. One is called hilar or perihilar cancer, cholangiocarcinoma, and that the one risk factor is PSC or primary sclerosing cholangitis. So similarly, if you have a chronic liver disease, you'd be in a screening protocol. However, there are lots of patients, unfortunately, that develop bile duct cancer that or cholangiocarcinoma that don't have risk factors, and that's a harder population because you don't yet know who's at risk in those instances.
So, to dive more deep into that, what types of imaging or blood tests are used to help diagnose currently?
Yeah. So as I mentioned, just surveillance usually starts with an ultrasound and an AFP. So fairly easy test, very non-invasive. An AFP or alpha fetoprotein is a blood biomarker. Now, the caveat is, 30 to 40% of patients may not produce AFP, and so that's why the ultrasound component is also very important. Now, if a cancer is detected, so something abnormal is seen in your liver, or your AFP is very high and it doesn't make sense why that should be, but you can't quite see a mass in the liver, then that's when we do further testing. So usually those are either cross-sectional imaging, so a dynamic triphasic CT scan of the liver or an MRI of the liver, and those tests actually involve contrast for the vast majority. And there are two different types of contrast, but the idea is either getting a CT scan of the liver with contrast. And when I say dynamic or triphasic, that just means the different timing and ways contrast is administered. And that's just an order, how you put the order in the patient doesn't necessarily need to know more than it uses contrast. And same with MRI. So usually those tests will then define, okay, do I have liver cancer? For the vast majority, at least will give you an idea. Is there a mass in my liver? What does it look like? Is it pointing towards liver cancer? And then based on that, you do other appropriate testing.
Can you explain why is staging important in this scenario and in the simplest terms for patients?
Yeah, of course. So, like I said, if we say, it looks like someone has a primary liver cancer, and I know we're going to talk about biopsies, but some cancers, very few, like HCC, don't necessarily need a biopsy if the imaging characteristics are very classic in the background of someone with cirrhosis or chronic hepatitis B. Now, the vast majority of those patients, like I said, if you do a CT scan or MRI with contrast, have these specific characteristics. Now, once you confirm that based on size, number, location, extent, you will also need to do further testing, like a CT scan of the chest to make sure it hasn't gone elsewhere. Bone and chest are the most common places that liver cancers could go. So that's what's meant by staging. So you kind of want to see what the size is, what the number is. Does it invade any major blood vessels or bile ducts? And then, also making sure it doesn't go elsewhere outside of the liver.
How does a biopsy help guide treatment decisions?
Yes. So, as I said, with primary HCC, many times you can diagnose it with based on testing in the right background of patients with advanced liver disease or hepatitis B. However, there are times when it's not clear, and that's when a biopsy is important to distinguish, is this a primary HCC? There are some tumors that are mixed between HCC and cholangiocarcinoma, or is this actually a cholangiocarcinoma? And most other cancers, including if you think someone has intrahepatic cholangiocarcinoma or a hilar cholangiocarcinoma, that you do need a tissue diagnosis. And so that allows you again to definitively diagnose the cancer. It also gives you a little bit about what we call tumor differentiation, like how early is it, how more advanced is it. And then it also allows us to check for something called next generation sequencing, which is really gene sequencing, sorry, rather, to see if we have specific medications targeted at, the specific genes that the cancer may produce. It's probably the best way I can explain it.
What are some non-invasive ways doctors can assess liver cancer today, if you haven't already mentioned them?
Yeah. I think the testing that I mentioned, again, early screening for those people who qualified, and then for people that may really present incidentally, meaning you don't have the traditional risk factors and you see something in the liver, again, making sure you get better quality testing so we can clearly define it. So oftentimes a really good CT scan MRI should be able to. People do get nervous about contrast, but contrast does, and some of it, I would say just a small subset of all patients who worry about it, unless they have an allergy, really need to worry about it, and or have advanced kidney disease. But there's so many ways contrast can be modified that it's largely safe unless you have, of course, anaphylactic. And even then, depending on the degree of allergic reaction, we can modify with medications. So having said that, that contrast and timing of contrast really helps us kind of distinguish between certain features and helps us realize if something is benign or malignant and then kind of differentiate between these two liver cancers that we're talking about. So those are all non-invasive testing before we talk about invasive testing, which is, let's say a biopsy.
What questions should patients ask their care team after receiving a diagnosis?
Yeah, I think, it is very important to make sure you understand your diagnosis. Easier said than done because the number of patients that come to my clinic and are not sure if they have cancer or not. So sometimes as providers, we may say you have a spot in your liver, you have a mass in your liver, you have a lesion. You know, I, that doesn't necessarily mean cancer to patients. So you have to, I always really clearly define it. If I will say, you do have a primary liver cancer. So I think and I will define what it is. I think first and foremost, you have to understand your diagnosis. And if you don't ask questions, what does the mass, spot, lesion mean? And if you're in a situation that you're able to ask if you can see the images. In my clinic, we always pull up images so that patients can see what I'm talking about because it's so abstract otherwise. What does that mean unless you can see it in your body? So I think that's really important aspect. And then another thing that providers could shy away from, even maybe because it's not there, maybe you found it with a gastroenterologist and not necessarily a subspecialist like a hepatologist or a cancer doctor. Um, it's important to talk about what the cancer stage is and what that means. Sometimes it is uncomfortable when it's advanced cancer, but patients really need to know, right? They need to know what their options are. They need to know if it's curative or not. And then they need to know, okay, if it's not curative now, can I do certain treatments that may make it one day get to a stage where it's curative? Or if it's really not curative at all, what treatments do I have that can prolong my life and my quality of life? And if I'm just in a very bad spot, then, palliative care is very important. So I feel like as providers, sometimes we may shy away from some of those harder conversations because no one likes to tell someone that they have cancer or that they don't have a long time to live. But I think it's really important to have those, discussions early. And so those are things that patients can ask about, what is my diagnosis? Is it for certain? How do you know? May I see it? Can you pull up a scan? And also what stage am I in and what are treatments? And if it's not here, is there somewhere else I can go? And are there trials that I can do if it's not standard of care? So it's just the more you're informed about it, the more likely you'll ask those type of questions.